Hello, everyone. Today it's Rising Day, Rising the Unbeatable Shaping Experience with Dr. Emre Övsay. I'm, very clear about the rising situation, which I give you information about the webinars. I increase step by step all features about rising files. In that point today, we are going to go a little deeper for rising files, and we are going to check and learn the other possibilities what rising can do. Hello, everyone. I'm Dr. Emre Övsay, endodontist, R&D specialist, and creator of Rising. Let's start. And let me introduce you myself. I'm a lecturer, I'm a faculty member, I'm an R&D specialist, I'm a researcher, I'm an endodontist, and I'm always proud to be the key opinion leader of Fanta Dental Global. So, we have a big research team. My wife is also an endodontist, Dr. Ata. We made a deep research on rising files, which our research team that we are going to release much more scientific and evidence-based studies according to rising research team. We are going to share it with you, and we are very proud to be part of this product. In here, as we start last webinars, we are going to talk about firstly about our magnification systems. For a magnification system, it's a very important part for our lives. What we do here with magnification is to clarify and capture the best images that we do in our clinical practice. This is our microscope MCA 𝗘𝘅𝗽𝗲𝗏, and it has very clear images for capturing videos while you are doing your case. I will share my presentation again according to a problem from the Wi-Fi connection. And okay, we're talking about our microscope MCS 𝗘𝘅𝗽𝗏, which is a very, very clear microscope for capturing images on your clinical practice. Swing arm is very important to make a 360 rotation while you are operating a patient. The binoculars and the lenses have the best quality according to our competitors, and the focal distance is very important to create a great clarified image capturing. Also, the microscope has a lot of accessories, so you can make a broadcast online while you are operating your patient. You can connect your iPhone to the microscope, then you can open an Instagram video, live video, so everyone can watch and see what you are operating. Yes, all videos in my presentation are shot by our microscope, capturing the best images. We always talk about the root canal system with combined morphology, with different types of root canal system. We have to get a conicity of the root canals. We need to irrigate, we need to shape the root canal clearly, and we need to make a final irrigation and compaction procedure to complete our totally patient, our root canals. We are dealing with a very, very different system. The cases are getting harder and more stuck canals, more calcified canals, more problematic cases. Everything is sometimes very difficult for a clinician to complete the procedures about the root canal treatment. We are dealing with apical deltas. We are dealing with connected canals, which we need to shape, irrigate, and finish the final therapy of the root canals. It's not easy to finish a therapy in a short time. We need a long period of time to complete all our procedures. But for shaping experience, we are giving you opportunity to have the best shaping experience with the rising files. So you won't have any problem with the shaping procedure. However, I do the root canal, you do the root canal, the results will be the same because we have the charts to complete our cases easily and more efficiently with the rising file system. In time, rotary files change, metallurgy change. I'm going to dive into rising to give you the sneak peeks of the files. You know, for the past rotary files, we were in the austenite phase. We were trying to get the best results in those days while I was making my PhD. I was using files from different brands to understand the visuality of the nickel titanium and to get the best results for the cases. After in time, nickel titanium changed, years passed, we passed to martensite. I'm not going to make you bored about the stages of the nickel titanium, but to give you an impression and give you details about the rising, I need to give you information about the nickel titanium stage. That's why I'm mentioning this. New stages give us the opportunity for the bendable files in room temperature, better shaping ability, better cutting efficiency, and better shaping experience in our clinical practice. In that point, when you see two files with naked eye from two different brands, you cannot understand and clarify the details of the files by just looking at the file. Because when you look at the files, they actually look the same in room temperature, but they are not. So their metallurgy is different. Their electropolishing stage is different. Their nickel titanium is totally different. So we cannot understand the visuality of the file according to our naked eye. With rising system, we have to clean the coronal 1/3, middle 1/3, and the apical 1/3 to finish the shaping procedure. For all file systems in the market, always there is the type to express themselves that we had the better shaping experience. But to maintain the best shaping experience, you cannot use just one type of nickel titanium metallurgy. It's not possible. With just one type of nickel titanium, you cannot complete all of your cases. It's not possible because in some cases, I need my file to be flexible. In some cases, I want my file to be bendable. And in some cases, I need a hard file to pass a calcification. And according to rising system, we have the hybrid nickel titanium included in the system. So in that way, when we use rising files, the all files nickel titanium level is different from another. All of the files has a different shaping ability. All files have a different shaping experience. The tips of the files are totally different from one another. And for that reason, you can use rising in your 99% of your cases very easily without no need of any instrument. And if you have a rising kit, you can solve all your problems. According to studies, it's assumed that we need to preserve pericervical dentin. According to the study, 4 millimeter from the coronal part and 6 millimeter from the root canal surface is enough for us. According to the clinical conditions, 4 from the coronal part and 4 from the root canal surface is actually enough for us to preserve pericervical dentin. In that point, you need to preserve the dentinal walls because the long-lasting after the root canal treatment, the long-lasting of the tooth, the time for tooth survival is very important in clinical practice. That's a basic point that what we try to do with the rising files. What about the taper? What should we do about the taper of the instruments? If you want to make a minimally invasive shaping, you need to have 5 taper or less taper to complete all of the shaping procedure. When you look at the files in the market, there are some promotions that they say that they are making an anatomical shaping, but actually they are not anatomical because they are higher than 5 taper. They are variable taper. A file can be variable cross section. Okay, this is in the nature of today's file systems. But the file, if the file is variable taper, this means taper significantly increases in every movement of the file inside the root canal. So it enlarges the taper. What is the difference of rising is that rising is a fixed taper file with variable cross-section. So your taper will be as the same as you start shaping your root canal. So if you force it, if you shape, your taper will not change because it's a fixed taper file. Rising is now in our inventory with Fanta Dental, with our small devices, with our hand files, with our other additional things that we include in our inventory. Colleagues ask me some questions when I go to lecture worldwide. They ask me some questions about rising files. I'm going to give you the answers today of these questions. We have the 𝗥𝗶𝘀𝗶𝗴 that we, as a Fanta Dental, we produce 𝗥𝗶𝘀𝗶𝗴 and we have very nice 𝗥𝗶𝘀𝗶s. And our colleagues say that I use Fanta files now, but I will pass to rising. But I have Fanta 𝗥𝗶𝘀𝗶𝗴 in my clinic. Can I use it with rising? Of course, you can use the ordinary, our 𝗥𝗶𝘀𝗶𝗴 for rising file. It's possible. But if you use our rising special 𝗥𝗶𝘀𝗶𝗴, your apical talkback will be very good. So rising 𝗥𝗶𝘀𝗶𝗴 has zero tolerance. It means you shape the root canal without losing the working length. Then you place your 𝗥𝗶𝘀𝗶𝗴 and you got the result. What is the difference between the ordinary 𝗥𝗶𝘀𝗶𝗴 and the rising 𝗥𝗶𝘀𝗶𝗴 is the R4, because R4 is a special taper and special number that has never done before. So number 28 with 5 tapers, 𝗥𝗶𝘀𝗶𝗴 is totally different. So this means for rising best experience, we always advise you to have the rising specialized 𝗥𝗶𝘀𝗶𝗴 for the best results, okay? If you shape it rising and place your 𝗥𝗶𝘀𝗶𝗴, rising's own 𝗥𝗶𝘀𝗶𝗴, it will be in a perfect condition for your root canal system. You don't have to cut the 𝗥𝗶𝘀𝗶𝗴 or you don't have to try to fit the 𝗥𝗶𝘀𝗶𝗴 at the apical part, okay? Rising 𝗥𝗶𝘀𝗶𝗴 is the best option for you if you want to obturate the root canal after shaping with the rising file. Rising is our patented product. We have a little time for the global patent. At the end of this month, it will be globally patented product for Fanta Dental Global. And we are very happy to release that product because as we talk with our colleagues, everyone is satisfied with the rising files and they are waiting time to use the files as soon as possible in their clinical practice. When we talk about a case-based rotary system, it is rising because, as I told you in a few moments before, rising is composed of a system. Many cross-sections, many different nickel titanium, many different types of shaping abilities of files together to have the best experience for shaping. It's very important for us to make a file system like that to complete all the procedures with rising. Imagine you have a file system, just a one file system is everything included inside. So you will do 99% of your cases. And the other question of colleagues that they asked me, can I do 100% of my cases? Of course you can do. Just sometimes a special problems about the teeth can occur 1%, like internal resorption or another types of therapies. So in that point, sometimes you don't need to use a rotary file system. You need to use, if there's a resorption, sometimes you just irrigate and you just use a hand file to reach the root canal. This is the 1% of the cases, but 99%, maybe 100%, you can use rising for the cases. A hero is going to rise with rising and Fanta Dental.
Shine bright like a diamond. Shine bright like a diamond. Find light in the beautiful sea. I chose to be happy. You and I, we're like diamonds in the sky. You're a shooting star, I see, a vision of ecstasy. When you hold me, I'm alive. We're like diamonds in the sky. I knew that we'd become one right away. Oh, right away. At first sight, I felt the energy of sun rays. I saw the life inside you. Shine bright tonight. You and I, we're beautiful like diamonds in the sky. Eye to eye, so alive. We're beautiful like diamonds in the sky. Shine bright like a diamond. Shine bright like a diamond. Shining bright like a diamond. We're beautiful like diamonds in the sky. Shine bright like a diamond. Shine bright like a diamond. Shining bright like a diamond. We're beautiful.
Yes, rising specialties that I'm going to mention you, that it makes minimally invasive shaping. It has extreme cutting efficiency and maximum debris removal. How it can remove lots of amount of debris is that its special design, it smoothly removes debris from apical to coronal very easily and efficiently. Extreme cutting efficiency, about the cutting angle, which I'm going to mention a little about it today because we are waiting for the patent approval, and it makes the cone fit perfectly because the 0.5 millimeter of the special design at the apical part creates you the apical tagback, so you can easily have the result of apical tagback at the apical part. It's very, very easy to make a cone fit with the rising system. That's how we achieve during our clinical practice. Yes, from Stenito Martin side, starting from the normal night eye, it's AFL wire, it's AFR wire, and now we are in the level of extremely flexible. But what we do for extremely flexible is changing the metallurgy of the nickel titanium in a different level, because it's bendable and flexible in room temperature, but it's harder and stiffer when it hits the calcified tissue inside the root canal system. So what we do is here that to create the best nickel titanium, to have the best results while we are achieving our shaping procedure. And the cutting angle dynamically shifts in every rotation with the rising system. So you get the best results from the rising files while you are making your shaping experience. It cuts so smoothly that you get the best results for the shaping experience. This is the SEM image of the R2 file. It's rotating, but as a different kind of rotation. It's achieving inside the root canal. Same file, different rotation, while you are achieving the root canal treatment. What makes it us that we understand the possibility of one file that can touch every part of the root canal system with the best shaping experience. You start shaping it like that and it changes the motion to another eccentrical movement that captures and grabs the debris inside the root canal, so you can have the best shaping results. This is the SEM image of the file that has a very clear cut and a very clear cross-section. As we always say, we increase the machinability of nickel titanium and make electropolishing more smoother than ever. So in electropolishing state, our files have the best cutting experience, and we increase the electropolishing much more than compared to other file systems in the market. Rising in your mind flashes that it will make a smooth shaping procedure while you are operating your patients. It's smooth, and when you finish the shaping with your rising file, you can check under the microscope how you are achieving a smooth and clear root canal surface, the openings, the orifices, and the internal part. In R&D part with Fanta Dental Global, what we do is our research team shapes thousands of teeth and we check them under the microscope for internal possibilities. And we all see that internal parts of the tooth has a very smooth shaping procedure. Then we are going to publish these articles in 6 months of time that you will see the evidence-based results. What is the shaping ability of the rising files? What is the maximum capacity of debris removal of rising files compared to other file systems in the market? Because every file system says that we are the best rotary files for shaping experience. But we will see with rising which is best and which is not. The cases that we make with the rising files as a premolar case, you can use the sequence which I'm going to show you in a later time. For especially premolars, R4 is our key point for intermediate file. R4 is sometimes a recapitulation file, sometimes a finisher file. Sometimes you can cross the curvatures inside the root canal system very easily to complete the shaping experience of the rising files. In that case, you see the distal root canal is totally stuck. Also the mesials, and with 3 files, you can finish your shaping procedure. When there's a calcification, our glide path file is very important in that case, because you can pass the calcified surface with the glide path file and you can reach the working length very easily. In that point, most of the colleagues ask me that question. Do you use a hand file to capture the calcified surface or to capture the calcified tissue. In that point, we have a lot of hand files. We have C-flex, we have natrophiles that we can pass the calcified tissue, we can pass the blockage inside the root canal system. In our charts also, we need to negotiate with C-flex for the root canal opening. But mostly with the glide path file, you will not need to use your hand file again and again to check the working length. Because with the glide path file, after you check with C-flex, you can directly reach the working length without any problem. So in that time, you use 10 C-flex to negotiate, but you don't have to repeat the procedure again and again to reach the working length for that point. Rising makes 3D shaping procedure inside the root canal. With the rising system, we put rising into many procedures in our R&D research. So we are trying to produce a file that will help you in all of your cases without any problem. About the durability, about the shaping ability, about the management of the file, about the charts, about the usage, about the action of the file inside the root canal is very important for us to finish our procedures with the rising file. We are in the level of top manufacturing files with the rising file. With rising, it's not possible to have a negative problem while achieving your root canal. You are avoid of perforations with your clear file. You are avoid of any problem, any procedural errors doing your root canal treatment. Let's see a case with rising. Very clear and dry for the root canal. It's the major problem for us to enter. When we enter the root canal, it's a major problem that it stucks our file. We can break the file inside, but with our orifice shaper, it's not possible. This is the R2. Look at the movement of R2, a special eccentric movement that we use. Heating the solutions with the heater. And it's captured by our microscope. To start with the files, let me remind you the type of files. Which files do we have in the rising system? Starting from the rising RR, our orifice shaper, that you will have the best orifice shaping experience. Some endodontists advise you not to use an orifice shaper. They say that you can just die with one file inside the root canal and continue your root canal treatment. This is an old technique. What they do is they compromise the stress on the file. So when you insert the file inside the root canal, all the stress will be emitted by the file system. But if you use the orifice shaper, you will lose most of the stress while you are operating inside the root canal. So when you use the orifice shaper, you remove the mass of debris outside, then you insert your file and use as a single file system. You know, for rising, you can use the orifice and number 25 as a single file system while you're operating inside the root canal. After RRs, it has a semi-active tip, so it grabs the calcified tissue, it grabs the 𝗥𝗶𝘀𝗶, but it will never cause a perforation. When you press the file, it's a very, very intelligent file that it will bend and turn back, so you don't have to suck inside the root canal. That's not possible with the rising files. We have R1, which is bendable, flexible in the room temperature, but after inserting into the root canal, it gets stiffer and harder when it hits the calcified tissue. It will pass perfectly and open your glide path very easily with the R1 file. So it's possible to make a very clear and nice opening for glide path when you insert your R1 file into your root canal system. With our shaper files, R2, R3, and R4, you can stop in R2, you can continue to R3 or R4 according to our chart, so you can have the best shaping experience with our shaper files. The most important part for the shaping files is that when you start shaping with the shaper file, starting from the R2, you get the apical tugback. With R1, you don't have an apical tugback. It's the glide path file. Its job is to open your glide path. But from starting with R2, you can create a tugback point so you can fill the root canal without any problem. With R2, R3, and R4, you can get a little bit larger for the upper molars, palatal surfaces, distal root canals, and the other parts of the root canal system while you are operating inside the root canal. As I always told you about the procedures, R4 is a magical key file of the system. It's a very different file. It is an intermediate file, it's a passage file, it's a recapitulation file. It's the most flexible file for you to have the best shaping experience. R4 is very important. The other question of the colleagues that asked me, do I need an R4 to complete my case? Because I want to go just directly RR, R1, R2, and R3. And I don't need an R4. Yes, ladies and gentlemen, while you are operating a case, sometimes you need a file between 25 and number 30. Imagine that case. You shape at 25, but number 30 stuck somewhere inside the root canal, and you force the number 30 to reach the apical, but it does not. So what you do is you recapitulate, you irrigate, you recapitulate, and you shape the root canal again. In that point, R4 is your file. You insert the R4 and you capture the intermediate size between R2 and R3. The other point is here, what if I finish with R3? You can finish with R3 and you can fill the root canal with R3 𝗥𝗶𝘀𝗶. But in some cases, the larger files cannot shape the curvatures very easily. So in that point, you can use R4 to capture the possibility of the curvatures, and you can shape directly the root canal and finish with your case with R4. What the difference is here, that R4 is number 28 and the taper is 5. And everybody is asking me the question, what will I do if I finish with R4? You will fit your 𝗥𝗶𝘀𝗶 with the R4 specialized 𝗥𝗶𝘀𝗶. Or you can use R3 𝗥𝗶𝘀𝗶. it's both totally you get the same results because we make the manufacturing procedure very clearly with the 𝗥𝗶𝘀𝗶𝗃. So our rising 𝗥𝗶𝘀𝗶 will probably, I'm repeating, will exactly fit with the instrument. I'm the designer of the file. We combined our work and we get the best results with Fanta Dental Global. We want to remove the possibility of the 𝗥𝗶𝘀𝗶 fit from the market, okay? Because in the market, you buy a 𝗥𝗶𝘀𝗶, always the same question. The 𝗥𝗶𝘀𝗶 does not fit with the instrument because of the tolerance of the production stage. But with Fanta Dental Global, we are getting rid of this. We are opening a new era. In the editorial facts of Rising, it says a new era starts because you are not going to have a problem with the 𝗥𝗶𝘀𝗶𝗃, with the talkback, with the shaping experience, with the possibility of file breakage. So we are opening a new era with Fanta Dental to show you that we have the best files in the production stage and we are going to release to the market so you can test our files and understand what we say. The Rising system is different from all of the rotary files in the market. So when you use it, you will understand what we mean about the Rising files. This is the Rising system. Every file is 450 and 2.5 Newton. With our new endomotor, Rising system will be integrated inside and you will have you will press the Rising button and you will have the Rising torque and speed and you can directly use it for the cases. As a single file, you can use number 25 and the orifice shaper. Single file technique is actually not single. You need to use the orifice shaper and with a single file technique, number 25, and you can complete all the procedure very easily. For large canals, you can go to R3 and R4 to capture the best shaping experience. In that case, it's a 𝗏𝗏𝗃𝗏 case. After opening the orifice shaper, I go through the 𝗏𝗏𝗃𝗏 file. It will pass the calcification. Directly enter inside the canal. Now with R2, as you see the eccentric movement of the file, it's a very different type of file. You can finish the case according to the needs of your file system. For the easy canals, for straight canals, single rooted without curvature, you can just start with RR, continue with C-flex, R2 and R4. With the medium canals, you can use the glide pad file and make the fit cone with R2. For moderate canals, you can finish with R3. For hard cases, you can finish with R3, then R4. The difference here is the canals with 90 degrees, with extreme curvatures, double curvatures, and S-shaped canals. In that point, you will need R4 between R2 and R3. I know most of the endodontists are not familiar with a different type of file, but R4 is the key file for our system. And the other question, while I'm explaining you the details about the Rising, is that some dentists ask me that question. R1 is number 13. R2 is number 25. Is there a big gap between number 13 and number 25? How can I directly go with number 25 after I shape the root canal with number 13? In that point, I'm going to give you a little R&D secret that when you start shaping with R2, it starts shaping between number 20 and number 25. And when you finish the shaping procedure, you get the number 25. So according to its variable cross-section, it's easy to shape the root canal to reach number 25 very easily. It's the most important part in that point that you use R2 after R1. You don't have any problem. Your file will not stuck inside the root canal. And after that, you will continue with R4 and R3. And in that point, another question comes. How did you do that? This is our secret with Fanta Dental Global. And you will see in the later days that we will have other presents for you with the rising system. When we mean about the apical talkback, we shape the root canal, we place the 𝗥𝗶𝘀𝗶, and we create the apical stop, which has never done before with any file system. So this is the unique part of rising that you will have the best results for apical talkback. Let's see. We shape thousands of tooth with the file systems and criticize the pricing. Yes, the apical parts are the same. There is no difference. What we mean by apicals are the same. The apicals are same. That means when you shape it rising, you get the apical talkback without harming the anatomy of the apical 1/3. It means there is no difference. Plus, you get a very good results with the apical talkback. As you see here, we place the 𝗥𝗶𝘀𝗶 directly inside the root canal, and it's where is it to be in its very nice position at the apical part, as you see, and does not harm the morphology. Let's come to the durability of rising files. Is it a durable file? Our colleagues ask. It's durable. We made a study with the 𝗥𝗶𝘀𝗶, and we get much more time for file fracture compared to the temperature, room temperature, and compared to body temperature. We got the best results. What we do here is there is a large gap between the rising and 𝗥𝗶𝘀𝗶. It's much more durable compared to the other file systems inside the market. As you see here, our file starts to rotate inside the metal block. It breaks in 45 to 48 minutes. 𝗥𝗶𝘀𝗶 breaks in 11 minutes. It's a huge gap between the files. It's not just to mention that this is happening to all other brands. When we criticize and check rising with the other brands in the market, we get the same results, and we are going to publish them very soon. Let's see in that part how we achieve. We just go through with our orifice shaper. We irrigate. We shape the root canal. then we continue with the files. Look at the R2, it's acting very different. Then you can continue with the shaping procedure. And you can complete your tremolo case. Sodium hypochlorite or the other solutions to make the penetration more easily. Our Acto-1 Pro, the most powerful activator in the market. Now you can go with R4. I finished with the F-Max 3 just for the irrigation protocol. Just for activation. Then I completely finished the root canal. R4 fits perfectly. Yes, throughout the world, we have many systems in the market. With the R&D, we find that we are 5 times more away from the other file systems. This is our 5X rule that I'm going to mention you in all about my presentations that I will show you. It's 5 times more compared to other file systems. Debris removal is 5 times more compared to other file systems in the market. According to our R&D study, the cutting efficiency is 5 times more for rising compared to other systems. The elasticity of the file is 5 times more compared to the other files in the market. It's rising. The apical talkback, no file up to now in endodontic field has the ability to create the apical talkback experience for you or the other file systems. But if any file system provides you that it will create an apical talkback, rising is 5 times more compared to the other file systems in the market. Durability of rising is extremely much more than the other file systems. As you know, the flexibility is much more compared to other file systems. It's 5 times more flexible, bendable in room temperature and in body temperature. always start with the 𝗘𝗍𝗶𝗴 paper with RR. As you see here, how it grabs the debris. It carries 5 times more compared to any file system. This is the R1, our lighthead file. This is the R2. We are getting closer with the movement. It has a very special and different movement compared to any other file. We go through with R4. The debris moves from mathematical to horizontal file very easily while you are completing your root canal. Then we go with 2 with R3. Rising. Yes, for the 5 times rules, rising is shining brightly and a very, very clear position in the endodontic field. We talked with many of the colleagues who used rising, and they were very, very happy and satisfied with the rising results. I'm Dr. Emre Övsay, endodontist, R&D specialist, creator of Rising Files, and always proud to be the key opinion leader of Fanta Dental Global. For my special thanks today webinar, we understand the unbeatable shaping experience of Rising Files. We will continue with our webinar series, getting much more deeper with the Rising system. Thank you for today. See you next time.